Hello, ma'am. Welcome to DC Conversations.
Thank
So
you.
the very first question from me to you will be, how has your journey been so far? Where did you start? Just tell us a little bit about that.
Gosh, well, to begin with, thank you for inviting me on this. When you say where do I begin? Because I've been a doctor and an obstetrician way back since 1978. Yeah, so that's a long time.
It is.
I think I'd like to focus really on when the change happened in my thinking. In India, we're all trained as obstetricians to make pregnancy and childbirth safe, right? That's a big part of what we are trained for. But in that process, we were trained to look at pregnancy and childbirth as a catastrophe waiting to happen.
Mm,
So there was a lot of fear, and somewhere in this journey, we forgot that this is a normal physiological event it's a natural event.
mhm.
Some may go, get complicated, and those are the mothers we need to work on. So that thinking happened in the early 2000s when I began to read about, um, you know, preparing mothers for labor and birth. There was a book by Nutan Pandit that was the only one available at the time. And I loved her approach because I could resonate with her. She wrote a book for mothers telling them, enjoy this period, bond with your baby, don't get worried, this is natural. She encouraged them to be physically fit. And so I had mothers who would go swimming right up to 2 weeks before their birth because, I just loved that whole philosophy and I believed in it.
Mm.
Then I invited Nutan to come and run an antenatal session for some mothers. So we had a group of mothers that enrolled. So she spent a whole week here in Fernandez. And I asked her, can I join you in one of the classes to see, what is it you're teaching? And to make sure that we are on the same page. And to my horror, I discovered that while I believed all of this was natural, mothers should enjoy their journey, but when they actually came into the birthing room, we took over. We doctors took over.
Yeah.
Mothers had no choice. We told them what to do. We told them to lie down. We told them to take this medicine. I mean, I realized to my horror that, gosh, this is terrible.
Mm.
So that's when I began to review, reflect, read up more, and thought, this has to stop. If Fernandez wants to be honest and do the right thing, which is one of our non negotiables, we had to change. So we did a 180-degree turn throughout 80% of what I had learned, opened our minds to relearning, and we changed childbirth practices in Fernandez. And this happened around 2011. And we've had no reason to regret that decision. Yeah.
So what are the changes you brought in?
Yeah. The first thing I realized that it is a basic human right of every woman to be given the right information.
Mm.
So when you empower women
Yeah.
and encourage them with evidence based practices and tell them, why am I asking you to be physically fit? Because when you come in labor, it's a lot of hard work. And if you want to have a normal labor, you need to be physically fit. So you need to eat the right food, you need to do the right exercises. Then also tell them what happens during labor. How do you handle pain? We're here to support you because fear is the biggest thing that women are afraid of. Because any image of labor, you see a woman screaming with pain. And then you discover that it doesn't have to be that way. We can help you. and make sure that they have a birth companion. So for this, you start childbirth preparation classes with their spouses. So a whole load of things that we didn't do before we began. And once I realized that this is your basic human right to have information, we began classes in Hindi, Telugu, English, because no woman should be left behind.
Yeah.
We lowered the cost of childbirth classes because we thought people shouldn't be paying for something that's their basic human right.
Yeah.
So I actually ran childbirth classes free for 16 months to see how this would work. And we had 4,000 couples come through our doors. At the end of 16 months, my finance person came and sat down and said, "Are you convinced that everybody would want childbirth classes?"
Yes.
Somewhere we need to put a cost to this.
Yeah.
So we made it at a very, very low cost because we thought, so that's the first change, empowering the woman. Second, sitting and writing with her and asking her birth plan. How would you like your labor to be? Who do you want in the room with you? We encourage you to walk around. We encourage you to bring music that you want. We encourage you to decide if you want to birth in a position that's appropriate for you. We're here to support you. In other words, bring in respect, give the woman the power to make choices, assure her of support, and the fact that you're going to be there to encourage her. Now, as an obstetrician, I wouldn't be able to do that. If, for example, you come in labor, you may be in that labor ward for 6 to 8 hours. I can't sit with you for 6 to 8 hours as much as I would want to because I have to see an outpatient clinic. I may be called in for an emergency cesarean. So how do we give you this care? Midwives. Midwives are trained for this. They are trained to take care of women who are healthy, have no complications. So they take charge and they walk with the women through antenatal care. They are there when they come in labor. They are their companions along with their spouse. And they have to be highly skilled. So that's why we talk about training to global standards.
Yeah.
A nurse generally takes instructions, right? A midwife takes charge. It's a big difference.
Yes.
It's virtually changing her profession and getting into a whole new career path. Now she's responsible for 2 lives. So when you have a midwife whom you can trust, who knows what she's doing, you work along with them.
Yeah.
That's a major change.
Absolutely.
To let a midwife take charge and birth that baby. Until then, I thought I was the most important person in that birthing room. Once I started my journey with midwifery, I realized, good God, we doctors are not really needed if a woman is having a normal birth. She could birth beautifully without me being in that room. Women need me for my skills. So if I have a mother who's encountering a problem, let's say, she's not going to give birth naturally or normally or on her own, where she needs assistance, then I should bring my skills of applying an instrument that will make that birth safe. So that's where my skills come in.
Yeah.
So when you look at this, we call it the collaborative model of care. You're using your human resource appropriately. Make sense?
Definitely. I mean, correct me if I'm wrong, but I remember once when I went with my aunt, who was a pregnant lady, to a hospital in Bangalore.
Mm-hmm.
So she was very scared of, labor, getting into labor, and that kind of. She was feeling very anxious, and she had this phobia of getting into a labor room
Mm-hmm.
because she'd seen all kinds of things on television and stuff like that. So I remember one of the doctors saying that the only place, there's this hospital in Hyderabad who induce painless labor. And then they named Fernandez. So I was like, when I moved here, the first thing I was like, where is this Fernandez hospital? Because I still remember, I mean, was it? I mean, you pioneered this in India. How did that thing happen?
Yeah. So before my midwifery journey, when we started, when we were building the first hospital, we had moved our functioning to Mosam market area where we had leased a hospital to continue. And that's when we thought, can we introduce epidural analgesia and let women not, what I thought, suffer the pain of labor.
Yeah.
That was the obstetrician mind thinking. So I was very fortunate. A group of anesthetists agreed to work with us. So we had a 24/7 service. And by 1997, we had moved back in 96. In a few months, we had set up a 24/7 analgesia service, epidural service. So any mother could ask for a painless labor. And we became a center for teaching anesthetists across the country. They would come and spend time with us, and we would teach them. And honestly, I was under the mistaken impression that we were doing a fantastic job, which we were in terms of safety, in terms of women enjoying their labor, no pain. But what I did not realize till I started the midwifery teaching and training that you can have a mother enjoy her labor because there are other ways of handling pain. When you give an epidural, she doesn't feel pain below her waist.
Yeah.
So these women are lying in bed for hours, whereas with natural birth and non pharmacological options of pain relief, that mother is walking around and still enjoying her labor. So you see, there's a whole difference in thinking. But from 1997 till about 2012, we were the highest in the country offering painless labor.
Yeah.
Using epidurals. You're right. Yeah.
Yeah, because the fear, I guess women go for elective surgeries because they're scared of getting into labor, and they're very scared of the and also at that point I guess people were scared of dying during childbirth. That was also the biggest fear for women.
Yeah. I would put my first fear as pain.
Absolutely.
Because the only images you see is that.
Yes, yes.
But once you give her the knowledge, tell her that pain will be taken care of, and it's interesting, and there's enough evidence. When you have a birth companion whom you can trust, the need for painkillers comes down.
Yes.
Because your labor progresses. You've removed fear. Once you remove fear, oxytocin, the hormone that you need for pain, for labor to continue, flows beautifully. And women are so relaxed that they progress beautifully. You don't have to do anything. You just have to stand, support, monitor the baby.
Right.
These are things we never saw as obstetricians. We would start IV lines, we would put stuff into the glucose bottle, speed up labor, interfere. I mean, the things we did, I feel terribly ashamed that we did that. But at the time, that was the norm.
Yeah.
That's how we were trained. But once you realize that, hey, that is not right, we changed.
Yeah. So you've always advocated, natural birth. how much of a difference does it make to a woman to have, a C-section versus a natural birth?
Yeah. When you see a woman who's absolutely empowered with the right knowledge, has a spouse who's equally committed and confident, and if she's got no complications, she's healthy, you let her set into labor spontaneously, you're not inducing, no medication. She comes in, and you've got a midwife who has understood the philosophy. She's there just in the periphery, encouraging her. The woman is walking around. When the pains get stronger, she gets into a position that she feels is comfortable for her. She could be squatting. She could be on her knees. She could stand. She could lie to her side. And she births her baby without any one of us interfering, just giving her that support. And at the end of it, when she births the baby, you give her the baby to hold, skin to skin. The baby starts suckling on its own. The joy, the confidence, the love that's exuding out of every pore of her body is what makes it worthwhile. That woman feels absolutely like she's achieved a huge amount. And you can't take that joy and compare it with a C-section where she's just there.
Yeah.
We are cutting, taking the baby out. She's not experienced that closeness. It's very surgical. I'm not talking about cesareans that are necessary.
Yeah.
I'm talking about doing an unnecessary. You've denied her all of this. And what is more frightening is we have enough scientific evidence to show that babies who are born of C-section, who have not gone through the natural labor, the passage, normal passage, birth, have various diseases or challenges, let me put it this way. These babies have a higher incidence of allergies. They have a higher incidence of asthma. They have a higher incidence of childhood obesity, diabetes, and there is a suggestion that there may be a slight higher incidence of autism. Okay? Whereas if you compare them with babies that are born normally, the I can't get the word now, but the normal gut bacteria that is found, the microbiome in the mother's birth passage covers the baby. And that is protective.
Yeah.
So the baby doesn't suffer from all these allergies and other things that I've mentioned. So if I'm doing an unnecessary C-section, I'm birthing a baby who's going to start life on the wrong foot. So I'm actually birthing the next humanity.
Yeah.
Not giving them the right chance to thrive, not survive, but thrive.
Yeah.
So why would I want to do an unnecessary C-section? Because the long-term effects are huge.
Yeah.
Compare that to a woman who's gone through all this wonderful support in an atmosphere, in a birth environment where the lights are dim, the room just has a midwife, maybe another midwife to help, husband. It's quiet. There's nobody coming, closing, no bright lights, and comes through this holding her baby, not being separated by her, with any kind of cutting the cord unnecessarily, nothing. That is sheer joy. Maternal-infant bonding is established, and this is going to also ensure that this woman, the risk of her suffering postnatal depression is very, very minimal.
Mm.
A lot of, well, in a lot of our birthing rooms, not just in India, but around the world, women suffer disrespect and abuse. Take a 19-year-old pregnant, has no idea of what's going to happen. She's forced into the birthing room, no companion. She's dealing with strangers, masks. She's in pain. We're not giving her anything. She wants to walk around. We put her down. She's screaming with pain. We're shouting at her, stop screaming. We're asking her to part her legs and expose herself. And she's, scared. So she's hitting on the thighs. And you expect women not to be traumatized with this?
Yeah.
Whereas the midwifery philosophy rests on the foundation of respectful care.
Mm.
You put the woman and the baby at the center. Treat her with respect, with compassion, with kindness. Competence is a given. That's your baseline.
Mm.
You have to be competent.
Yeah.
But along with this, bring in that whole environment where you've empowered her. And you're asking her at every stage. If you find something's not working, you tell her, this is what's happening. These are the options. What do you think? And when women are involved in decision making, that whole experience is life-giving.
Yeah. Is it also true that, if you've had a C-section once, you have to go through a C-section again?
Not at all.
Because that's
Not
a
at
very,
all.
that's a myth that people.
No, and that's one of the highest reason for doing a repeat section is that
Yeah.
when a woman comes to a doctor with a previous cesarean, and if the doctor's operating solo, she doesn't have a 24/7 team.
Mm.
It's unlikely she'll take the risk of sitting with that mother for 8 hours, 10 hours, watching her, to give her a normal birth. You can't do it. It's humanly impossible. So, one of the risks of having a previous operation is the fear that that scar will give way during the next labor.
Yeah.
And if that happens, there is a chance that you may lose the baby if you don't do an immediate C-section. So if you're functioning in a tiny hospital, anesthetist not available, pediatrician not available 24/7, you are not going to take a risk with that mother.
Mm-hmm.
So you would prefer to do a planned C-section, get the baby, mother and baby are fine. Well, I'm so sorry, but we had to do a C-section because I can't take that risk with you. And she's justified, because God forbid one mother, that scar gives way and you lose that baby during labor.
Yeah.
You wouldn't want to take that risk.
Right.
So I believe very firmly that any hospital that offers maternity services can do its best with a 24/7 team that works seamlessly.
Yeah.
And is driven by protocol. So everybody's speaking the same language.
Yeah.
So the mother feels safe, that, okay, I'm in a safe environment. Yeah.
Yeah. So it's been over four decades. It's going to be like fifth decade. You've seen um, all kinds of doctors, and today also we have like talent.
Mhm.
Talent. There's no dearth of talent when it comes to medicine, right? What's the biggest difference you see in today's doctors? if you were to compare there? Is there a plus? Is there a minus? What is it like?
To begin with, I think youngsters today are far more sure of themselves.
Mm.
I don't think at the age of 22, when I graduated with an MBBS, I was so confident and sure of my choices as you see youngsters today. That's something I find absolutely amazing. But on the other hand, I feel their lives have become very stressful. Today, youngsters, they've got so many demands. One is living in a city like this, the traffic itself is quite. Then you've got to drop your kid at school, you've got to report to duty, you've got to be back so that you're there as a mother. I think working mothers today, particularly in this profession of birth, uh, lead very stressful lives. So that's why in Fernandez, for the last probably 20, 25 years, we've always supported the team concept. So when a mother books with us, by the second visit, she's given a consent form saying, we are a team. You may not have the doctor of your choice, but you will have a competent doctor, and the doctor whom you are seeing will be informed of, your and you can be in touch. So this way, you're doing some bit to reduce that stress because every doctor has at least 100 mothers who are booked under her.
Yeah.
There's no way she can come and personally deliver every mother. Whereas if you have this 24/7 team concept, the doctor who comes on night is fresh. She's able to make better decisions.
Yeah.
I believe very strongly in this. It would be icing on the cake if I could have the same doctor I've seen through 9 months be there at my birth. That would be icing on the cake. But when you're dealing with large volumes, then it's difficult.
True.
Yeah. So, but again, some of us have been there with mothers because if she's had, let's say, a loss the last time, she's got complications this time. She's very vulnerable. She's very scared. So some of us would come and be with the mother no matter what time she came in the night. All of us would do those bits for mothers, but to do it for every mother, I would not be able to give my best. So, so youngsters today, if they are working in hospitals that don't offer this kind of team support, I think it's very hard. And they are being, they get paid for every mother or every woman she delivers. Um, I think that's quite a bit of stress on them. To me, that's one of the biggest challenges. How do you offer good care without this, without burning out?
Yeah.
Um, to me, that's. And the second, of course, patients' expectations have changed, and rightly so, because information is available. And what I have learned more and more is the more honest you are with a I'm using the word patient very carefully because we don't call our pregnant mothers patients. We call them women who are pregnant or mothers to be. But she has a right to know. And there's so much distrust today in the medical fraternity that adds more stress
Yeah.
on doctors. And social media,
Yeah.
biggest challenge.
So one last question, ma'am. So what is your vision for Fernandez next?
I'd love to see more hospitals of Fernandez. Smaller hospitals, though, not necessarily 100-bed hospitals going forward. And particularly in places, not necessarily Hyderabad.
Mm.
I think Hyderabad people have huge choices.
Yeah,
I'd like to go into cities and towns where choices are less
mm.
and offer this care. And that's the vision I have. That's one part. But for me, more importantly, is the other two bits of work that we do at Fernandez, the teaching and the training.
Yeah.
Every year we get at least about 20, 22 postgraduates who come. I look at them as our future. You give them the right training, put that whole sense of ethics, respectful care. They become are agents of change. And it's so heartwarming because we don't have the money to keep building and building because we don't believe in investors. We're totally self funded. So the next best thing is train doctors with the right ethics and the right attitude and the right values. And God willing, they become lanterns of change. So you're building this network of future doctors who you hope will carry this message. The third is to be able to work in communities. Like we work with the government, we work with the AP government, where we are training doctors in public hospitals. So the joy that you get in getting all of this that I spoke about, protocol led practice, compassion, dignity, privacy, getting a woman in a public hospital to birth with a companion and not be alone. To get these changes by working with the government, you can't put a price on that joy.
Yeah.
So
Absolutely.
this is what I would want Fernandez to continue doing. Yes.
Amazing. Thank you so much, ma'am. Thank you for talking to us. Lovely conversation.
Not at all. Thank you.
Thank you.
Thank you for your time.